Poor glycemic control incrementally increases the risk of atherosclerosis. Incrementally. How important is that? Finally, the platelet hyperreactivity likely has major relevance for macrovascular disease and PAD in those with diabetes. A number of mechanisms contribute to platelet dysfunction and hyperreactivity in diabetes, many of which may also play a role in pathogenesis of PAD. Upregulation of glycoproteins among patients with diabetes interacts with von Willebrand factor and fibrin to trigger thrombogenesis. Occurs at young age in patients with diabetes, and several other factors influence the occurrence of PAD in patients with diabetes, including duration, diabetes severity, sex, race, ethnicity. They play a role as well. And PAD risk is also associated with peripheral neuropathy, a burning or painful discomfort of the feet or thighs, which often leads to delayed PAD diagnosis. And duration of diabetes correlates with incidence and extent of PAD. This was shown clearly among 3,834 participants in the United Kingdom Prospective Diabetes Study Group, UKPDS 59, which showed a higher prevalence of PAD among participants with longer duration of diabetes mellitus. Diabetes severity. Poor glycemic control incrementally increases the risk of atherosclerosis. Incrementally. How important is that? If somebody's hemoglobin A1C has been in the range of 7 throughout their life compared to somebody whose A1C has been 9 or 10, we are talking about a huge difference in terms of risk of PAD and associated complication. A systemic review identified 13 studies evaluating hyperglycemia and cardiovascular risk reported a 26% increase in the risk for every 1% increase in hemoglobin A1C. That's huge. So, rough number 25% for every 1% increase. So, somebody has 7 A1C and somebody has 10 A1C, the risk goes up by 75% with somebody A1C having 10 compared to somebody who has 7. Even before reaching a diagnostic threshold for diabetes mellitus, 20% of patients with dysglycemia alone have an abnormal ABI compared with only 7% of patients with normal glucose homeostasis. Diabetes associated vascular calcification. Diabetes mellitus is frequently associated with medial arterial calcification. The medial layer of arteries are calcified, which is a totally distinct process other than atherosclerosis. And it is characterized by precipitation of calcium phosphate within the medial layer of arterial wall. A medial artery calcification is strongly associated with diabetes. Further, the combined prevalence of diabetes and chronic kidney disease is associated with even higher rates of medial artery calcification. The presence of medial calcification increases the risk of major adverse limb events in those undergoing intervention. Interestingly, the use of metformin is associated with a reduction in the medial artery calcification seen in patients with diabetes. Patients with diabetes have more advanced arterial disease at initial diagnosis, increased risk of progression, and risk for worse outcomes compared with those without diabetes. In addition to poor outcomes, patients with diabetes mellitus are more likely to have arterial disease distal to the knees compared with those without diabetes mellitus. And a growing number of studies have suggested an increased risk for even mild to moderately reduced kidney function. As such, CKD, chronic kidney disease, is now considered CHD risk equivalent, coronary heart disease risk equivalent. PAD appears to be more prevalent among patients with CKD than in general population. And chronic kidney disease is independently associated with an increased prevalence of PAD and with the future risk of developing clinically significant PAD. And there's a higher prevalence of abnormal ankle brachial index less than 0.90 among patients with a low estimated glomerular filtration rate GFR in those with albuminuria. And moreover, patients with end-stage renal disease are at increased risk of vascular calcification which independently increases the risk of cardiovascular morbidity and mortality. Calcification is an active cell mediated process involving regulatory proteins involved in the bone formation and a structure that become expressed in arterial tissue and lead to ossification of the vasculature. And patients with the chronic kidney disease are more likely to present with chronic limb threatening ischemia due to more diffuse and distal disease compared with those who have typical kidney function, possibly reflecting the high prevalence of coexistent diabetes in this population.